Hi, my name is Brittany Schisler. I'm a graduate student at the Chicago School of Professional Psychology in the clinical psych program with a specialization in marriage and family therapy. And I'm here to share my research about suicidality among middle school students. So during my research, I found that suicide is the second leading cause among this age group. More teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease combined, which is obviously a huge number. Numbers of rates of suicide have doubled since 2006 in children ages 10 to 14, and each day there's an average of 3,069 suicides or more, suicide attempts by young people. 4 out of 5 who attempt suicide have already shown warning signs, but unfortunately, not everyone is trained in what to look for. Some warning signs include suicide threats, depression, anger, and increased irritability, lack of interest, sudden increase or decrease in appetite, sudden change in appearance, perhaps falling academic performance, a preoccupation with death and suicide, obviously previous attempts, and making final arrangements such as giving away prized possessions, saying goodbye to people, talking about funeral planning. All of these can be a sign, and some of them, such as like the increased irritability, change in appearance, lack of academic performance, can kind of seem like normal teenage behavior. So it's good that we are aware that these could be potential signs of suicidality. Suicide typically does not have a sudden onset. There are a number of stressors that can contribute to a youth's anxiety and unhappiness, which increases the probability of a suicide attempt. Some of these risk factors are depression and mental illness or substance abuse, aggression and fighting, a poor home environment, community environment, or school environment, bullying, previous suicide attempts, cultural factors, family stressors such as death, divorce, remarriage, moving to a new city, financial instability. Self-mutilators are more likely to attempt suicide. Situational crises, and actually approximately 40% of youth suicides are associated with an identifiable precipitating event, such as the death of a loved one, the loss of a valued relationship, parental divorce, or sexual abuse. Among this this age group that is particularly high in suicide rates, there's a subgroup of, like a minority group, that actually has a much higher rate of suicide, which is these high-risk groups, such as youth with disabilities, mental illness, substance abuse, youth experiencing homelessness, and LGBTQ youth. Oftentimes, these kids are bullied in school, afraid to come out about their situation. There aren't a lot of other kids around them that are like them, and this causes them to feel more isolated and thus consider suicide. So 2 resources that I found that were pretty universal were the crisis text line. If you text JASON, JASON, to 741-741, you can speak with a trained crisis counselor confidentially, 24/7 for free. The crisis counselor helps you move from a hot moment to a cool, calm, safe moment using healthy, effective, active listening. They can provide referrals, and this is all through text message because oftentimes kids don't want to talk on the phone. There is an option for a phone line, the National Suicide Prevention line, which is 1-800-273-TALK. It's a free 24-hour hotline available to anyone in suicidal or emotional distress. You'll be routed to a crisis center near you. I've created a list of other resources: the American Association of Suicidology, American Foundation for Suicide Prevention, the CDC, the JED Foundation, NAMI, National Council for Suicide Prevention, the Samaritans, the Trevor Project, which works directly with LGBTQ youth, and the Yellow Ribbon Suicide Prevention Program. Along with these resources, some helpful tips for parents, caregivers, and any other influential adult in an adolescent's life are as follows. So first, I think having a sense of connectedness is extremely important among this age group. A lot of times they're going through a lot of changes, they're feeling alienated, aren't sure that people are going through what they're going through, and kind of normalizing this experience and making them realize that there are other people going through this, that they're understood, that there's a safe space for them. That is obviously most important. This could happen through groups at school, in the community. Another thing is just having more open communication. Oftentimes people are uncomfortable asking questions like, are you thinking of committing suicide? Have you had thoughts of killing yourself? And being more direct, we're not actually planting the seed in the child's mind. Rather, we're taking away the stigma and the uncomfortableness by it's giving them some relief and letting them know, like, it's okay. Obviously we want to ask this in a non-reactive way and help them open up and express their feelings and let them know that we're here for them and that we're not judging them for what they're feeling, and that it's actually quite common, especially for kids this age group. Some other things you can do are identify some non-parental helpful adults, teachers, family friends, aunts, uncles. Sometimes kids just don't want to talk to their parents, and that's okay, as long as we can identify other safe adults for them. And lastly, something that I think is very important, kids these days are in a lot of high achieving academic situations, and then they kind of go to these competitive sports after school, and it's like they're always having to achieve something. And self-directed play, I think, is a key to the suicide prevention. Letting a kid do what a kid wants to do, what makes the kid feel good, and not pressuring them into constantly performing for us. This can be hanging out with their friends, maybe playing a computer game, some downtime, doing what they truly are passionate about and want to do, and being enthusiastic about it is another great resource. So again, thank you for listening, and I hope that was helpful.